Welcome to the weekly blog. My name is Dr. David Hutchings. As always, this is being sponsored by SpectrumMed. Before we jump into a very important topic today that's really near and dear to my heart to chat about is respite care and the importance of having respite care for your caregivers. Before we jump into that, quick housekeeping thing is we do have a lecture tomorrow. It's at 1:30 for the Alzheimer's Association called Understanding Dementia and Alzheimer's Disease. I think it's a pretty packed house so far, but if you're interested in getting into that, just let me know and we can get you sent the link. So certainly just reach out to us. We'll be happy to get you that link to attend that lecture. So again, a topic that's really near and dear to my heart is the importance of respite care and the importance of taking care of the caregiver. We spend so much time talking about taking care of the patient, but we also have to think about the caregiver. And in countless lectures and also with all my patients, I always say that I feel like you kind of have two patients. You have the patient themselves that we're taking care of. We're trying to manage the symptoms of the illness, but then we have the caregiver themselves, which there's an incredible, I can't even begin to sit here and tell you what this journey is like unless you've gone through it and the impact that has on the caregiver themselves. So it's really important that we look at having respite care. We look at making sure that there's a certain time set out, maybe every single day, or the same, maybe a few hours every single week, that the caregiver can actually get out, do some shopping, just take a break, and that's something that obviously can help the caregiver kind of get some rest, but also come back and feel refreshed and be able to take care of their loved one even more. So definitely I think looking at the right respite care companies is the next thing, is making sure that you find somebody you can trust, making sure that people have background checks and maybe even some training in dementia. And something else I've learned through years is making sure that we also have somebody that is trained on who to call in case of emergencies, in case the patient has a fall or something happens within that time period when the caregiver's gone. So I'll conclude by saying that this is incredibly important because we are seeing now that the patient is outliving the caregiver. That's a tremendous statement to say, and then we've seen that the ER rates have gone up by about 85% for folks who have or caring for patients with dementia and Alzheimer's disease. So it's critical that the caregiver is taken care of and has time to every single day or every single week to basically get some rest so they can take care of the loved one. So we'll see you again next week with some more topics. Keep the questions coming through email, and that's how we generate our topics every week. So see you again next week. Thanks. Bye.